how do you change the way you study an organism from looking at individual images under a microscope to having the entire instruction set for that organism written in a language you do not know? And so that was the birth of this amazing problem that joined statistical methods with multiple centuries of domain expertise in biology. So you have a natural science, you have abundant data, you have no models as to how to put those data together with that domain expertise. And that challenge we would now call data science. Health is a field where there are abundant data, and there are constantly changes in health that allow us to quantify ourselves or our patients at far, far bigger scale. So health is a field where large data sets plus health is going to be transformative, and I'm very interested in how we can take tools of machine learning and predictive modeling from machine learning and apply them to large and extremely messy health records. Right? And one of the interesting things about Columbia is we have a great medical school, and it's a medical school with a department that's very forward-thinking about how data might be used to solve real health problems.
Within Columbia University, one goal is to really strengthen the link between the engineering school and the medical school. With our collaboration and our partnership with YORK-PRESBYTERIAN Hospital, we are in a unique position because we have access to more than 20 years worth of data about patient records. And so it's kind of for us like a living laboratory, and we can look at it both historically and cumulatively. We can try to understand what are the trends of healthcare. We can build tools for clinicians as part of the hospital.
Probably just see what the nephrology note says.
No,
she doesn't have myeloma. I can tell you she has MGUS.
And we can learn about health in general by looking at trends of patients that stayed in our institution for these 20 years. What does it mean to have diabetes in very concrete terms from a data standpoint?
This is what, 1, 2, 3, 4, 5, 6? Yeah, so I bet that there's a intramolecular hydrogen bond.
We're using big data approaches to identify new drug targets and therapeutics that might be useful for particular patient groups, a kind of personalized medicine approach. So we're designing brand new molecules using computational tools, millions of compounds, and testing them for their ability to interact with these otherwise intractable proteins. We're designing molecules and synthesizing them using chemistry, and then we're testing them in biology, and we're intersecting also with medicine with patient samples, and using an engineering approach to understand the networks in these cells.
Many of the research projects that I've worked on in the last decade have been about trying to take a developed field, or sometimes a field in which people were asking new questions, and seeing how that question can be reframed as a machine learning task. So biological networks, social networks, how do we bring machine learning to bear to try to understand these natural data?
So from the cellular to genomic to individual patient to entire populations, there's so much left to learn in medicine, and I think together between data and medical sciences we have a lot to work with.